our county is in pretty good shape. And if you want to be thinking about questions to ask, I have with me Dr. DuFrayne from Owensboro Health, been with me many, many times in this 15-month long journey. And so we're going to be asking him some medical questions. But first, let's do the update. So, Jordan, if you'll bring up the first slide talking about new cases and percent vaccinated. Okay, so from June 4th through the 7th, we had 15 new cases in Daviess County. And you'll note that's for a multiple day period. The health department now is giving us updates twice a week. You'll see where we've got almost 41% of our population in Daviess County vaccinated. One of the things I want to talk about, those who are 18 years or older, we have 53% of those folks vaccinated. And what really pleases me, those who are 65 plus, 82% of those folks are vaccinated. That probably contributes greatly to the reduced number of people that we have in the hospital, as well as a very low weekly or actually monthly death count. You'll see we have one person in the hospital as a result of COVID. Unfortunately, we reported a couple of new deaths this past week, and we have lost 188 Daviess County. And so if you would just join me in a moment of silence to remember them and their families. Thank you. The confirmed cases, we've now had 10,673 confirmed cases in Daviess County. That's right at 10% of our population. If you would bring up the map. There you go. Now that map looks considerably different than it has in the past because we have more yellow counties than we do total orange and red counties. You'll notice Webster County just popped back into the red. It doesn't take a lot of, when you've got about 15,000 people, you know, that's 1/6 of 100,000, actually a little less than 1/6. And it doesn't take a lot of cases when you go through the calculation for them to pop back and forth between red and orange. I was talking to Judge Henry. They've had a few cases in the jail, but typically this is just a case of community spread. The one thing I would note, and I'm not making a comment one way or the other than to tell you that vaccines work, and I think Dr. DuFrayne is going to shake his head. Vaccines do work. Union County and Webster County have a rather low vaccination rate in their general population, and it's a little better for those who are 65 and above, but vaccines work. And I think what you'll see if we brought them up, and I don't want to do it right now, Jordan, but in some of these counties that are in the green and some of the counties that have been consistently in the yellow, you will see as much as some counties are reporting 100% of those who are 65 and older having been vaccinated, and they are well up into the 60s and 70% range. So vaccines work, folks. Let's go to there we go. There's our grad region. You'll see Hancock County, our neighbors to the east, have less than 1, or they're actually at 0. Daviess County is now at 4.5, and that's about what the state's average is. Henderson's down to 6, McLean County at 7.8, Webster up at the 30.9. Now they were in the orange yesterday. They popped back up, and Union County at 13.9. As we talk about vaccines, if you're still wondering, where do I get a vaccine? How do I get a vaccine? You can go to Kentucky or kycovid19.ky.gov. Click on the top, vaccines, and you'll see, or you can go to vaccines.gov, and there's a list of 47 providers in our community that can provide vaccines. And you also, if you have trouble with transportation, you can call the GRITS, run by Audubon area. There we are. If you call them 24 hours ahead of time, they will come and take you to get your vaccine, and they will bring you home. So they're really, I mean, it's as simple and as easy as we can. Not to mention the governor's big giveaway that's going to start. You get vaccinated, And if you've already been vaccinated, you can sign up. But if you get vaccinated, you're eligible to sign up for, I think, 3 or 4, I can't remember how many, $1 million drawings, $1 million to some lucky person. If you're under the ages of 18, a full 4-year scholarship. So think about that, folks. If for no other reason, there's an incentive to get vaccinated. I'm going to talk to Dr. DuFrayne here in a minute, but if you're hesitant, once again, I urge, don't listen to me, don't listen to your friends, and certainly don't go on Facebook and try to find info. Call your family physician, call your healthcare provider, and talk to them about your hesitancy and why you don't think it's a good idea, or if there's some medical issue that you have, or if you're in those childbearing years. We've addressed all those with experts on here before, but sometimes we just need to hear it again from somebody that we have a really long-term relationship. So call your medical provider. With that, Dr. DuFrayne, welcome. Nice to see your smiling face. Nice to have you with us. And it's nice to be, what I hope, on the tail end of a pandemic. I hope.
And I agree. Last week, I was so encouraged. We got down to 1 person in the hospital. And I thought, oh man, we are so close. We popped back up a few, but we're still averaging now 3 to 5.
Well, and I was again encouraged. We got down as low as 2.8 cases per 100,000.
Yes.
I mean, now we popped up a little bit because we had a few, and of course in a county our size, it takes, I mean, the number is the number, right? If we have 10 every day for 7 days, our average is 10.
Right.
Other counties, as I said, in Henderson County, or in Webster County or Union County, they got about 15,000 people.
Mm-hmm.
So whatever their cases are, you multiply by 100,000 people, and
Correct.
and it doesn't take a lot to change. There are huge swings. Ours is pretty gradual. There are huge swings,
Right.
but I've really been encouraged, and I still see when I'm out in the community, people who wear their mask. Right. I mean, they're in. As a matter of fact, I went to Kroger's Sunday to pick up some groceries. I put my mask on. When I'm out and about, if I'm in close proximity to people, I'll put my mask on, and I think that you're going to see that for some time going forward. What do you think?
I agree with that. So when I'm out in public, once again, fully vaccinated, I'm fully vaccinated, but out in public around people that I really don't know, then I'm still more comfortable wearing a mask than not. And we can talk about all the variants and all the other issues. But we still have breakthrough cases. We have them here at our own team members at the hospital, fully vaccinated, coming down with what they think is a cold. We test them and they're COVID positive. So, and that's the beauty of the vaccine, is you can have a breakthrough case. I just saw a report, 60% of vaccinated breakthrough cases are asymptomatic. And for the most part, the rest are much milder, much shorter durations of symptoms, and a significantly lower chance of giving it to someone else. So across the board, the vaccine works.
I think, and I use these statistics and they're old, but back 1st of May, there had been 20 breakthrough cases in Daviess County. And as you said, 18 of them were asymptomatic, sniffle, just, they knew that they were a little, but of the 20, 1 ended up in the hospital, but not in ICU, they just went into the hospital. And from what I read, those breakthrough cases, the likelihood of you ending up in the hospital or dying from COVID is statistically, it's just non-existent.
It's non-existent. So if you look at the number of people across the United States who have been vaccinated, and then you really look at the number of breakthrough cases and then the number of hospitalized. So the last numbers I saw, and I have to admit, it was like 2 weeks ago. So 10 to 15,000 documented breakthrough cases, 200 to 300 hospitalized, about 5 deaths. out of 140 million people who have received a vaccine. So those numbers are phenomenally low.
Now, if you happen to be the one that passes away or really have a serious case, it
Right.
becomes significant. But
Absolutely. And I always say that to people.
yeah,
We'll talk about, in a minute, we'll talk about vaccinating even those under 12.
right.
And I have young children in my family. And when that becomes available, my recommendation to all my family members is get them vaccinated, because the number of cases of children having it is fairly significant. The number of symptomatic is low, and seriously ill and hospitalized low, and the death rate is low, thank God.
Right.
Except if
Yeah,
you're one of those families who has one of those.
that's right.
Right.
You know, there for many, many months, I started the update wearing my mask
Mhm.
and telling people that that was the best tool that we had in our toolbox at the time.
Right.
Now I tell them the best tool in the toolbox is a vaccination.
Correct. And that is true.
So just an update the governor gave us last week. He said that between March and April, during March and April of this year, 97% of the reported cases of COVID occurred in unvaccinated people.
Right.
That is
That-
huge.
That's
Now,
right.
somebody said, well, the other 3%. Well, the other 3%, the vast majority of them were people who had their first shot but weren't fully vaccinated,
Mhm.
and they came down with it. And then there were a few breakthroughs. So, I know people get tired of listening to us and hearing us say the vaccines work. And then some people will point to breakthroughs as a reason perhaps not to get vaccinated. Why should I get vaccinated? I can still get it. Well, that's true, I guess, with polio as well. There were breakthrough cases in polio and measles and mumps and chickenpox and whooping cough and all those other things that came around as I was coming of age, but we still took the vaccines.
Correct. And even when I speak with the people here at the hospital who have been fully vaccinated with breakthrough symptoms, their exposure was significant. A family member living in the house who was not vaccinated, and then the vaccinated person gets it because they really had a very large exposure. So your chances of getting it around vaccinated people are really small. And if you have a chance encounter with someone who's positive and you're vaccinated and you're only around them for a few minutes, very, very small. But when someone's living in your house with it,
Right.
that's where the breakthroughs are coming.
It's not just airborne, it's surfaces, it's all the things that you share.
Correct.
And I'm a perfect example of that because my wife and I were fully vaccinated. And then I became exposed to a very good friend of mine who actually spent quite a long time in the hospital. Thank God he recovered. And then another friend who had the same thing. And here I am. No issues, no symptoms,
Right.
no anything. I'm going to go back to that mask thing. It became so commonplace for Judy and I when we get out of our car and get ready to go into some place. We forgot our mask, and we go back and get the mask.
Mhm. Yep.
I mean, it's just in case, anyway. Well, big day come Friday, June the 11th.
Mhm.
For the most part, all the governor's mandates, all the state mandates, with some exceptions, mainly prisons and hospitals.
Yes.
And there are nursing homes. There's no need for those, particularly those who are fully vaccinated, to wear a mask. Social distancing norms have gone away, 100% occupancy. Tell me your opinion. What do you think there?
So I do think, given our numbers are so low and our vaccine rate continues to go up here at the hospital, we're at 60.5% vaccinated, all members across the board. So our vaccine rates continue to increase and our incidence goes down. So at some point we have to say, we got to open back up, but I'm still going to give a word of caution. And it's what you and I have already discussed. Until I know this is completely gone, will I wear a mask in some situations? You bet. So when I go to the store, if I'm in a place that's going to be crowded, if I go to a restaurant, I'll wear a mask in and out. I'll take my mask off while I have my meal. My family's fully vaccinated. Um, but I still want to give an air of caution. It's not completely over. We've had some people come to the hospital without a mask, and we've said, no, before you come in, you have to wear a mask. And their question is, well, this is over. Why are you mandating this? And it's like, well, it's not. It's very close, but it's not. And prisons, hospitals, nursing homes, it's still required across the country that you mask up. So everybody who comes to any of our medical treatment facilities, wear a mask.
I know I went by to see my personal physician last week, and wore the mask in the doctor's office. And when he came in, he had his mask on, I had my mask on, both of us fully vaccinated.
Right.
But it's just, I think it's good practice, good habit. And to prove that masks do provide some protection, social distancing and personal hygiene. Tell me about the regular flu and what happened to that this past year.
So I'm going to say all the measures that we took for COVID have really been shown to be very effective also in controlling the flu. So, and you look at societies where wearing a mask has been common for decades, Japan. In Japan, it's common courtesy to your community and your fellow citizens that if you have a cold, you put a mask on. So when you watch the news and there's something about Japan, it's not uncommon on a subway scene to see a number of people with a mask. So it works. So these are really public health measures that have been proven to be effective. And even if COVID doesn't come back, it would be nice to see next year when people start to develop cold symptoms and flu symptoms. I always tell people here at the hospital, because you think you have the flu or a cold, but you have to come to work, do us all a favor, you don't.
No, that's correct.
You don't. So let's control the spread of all this.
I find it interesting too that one of the things significant, in my opinion, that helped prevent the spread of other diseases was schools were out. A lot of schools were virtual, and we all know that schools are a breeding ground for infections that you're feeling perfectly fine until the kid comes home about midnight, you wake up with every disease that you thought about. Answer a question that people keep asking, this is a general statement. So how do you respond to this statement? I had COVID, I recovered, I don't need to get a vaccination.
I hear that frequently also. And the recommendations are still that if you had COVID, probably wait about 90 days and then get the vaccine. However, there are some studies coming out that's showing people who've had COVID, their antibodies are lasting a long time. We think they are what we call neutralizing antibodies. And I still think it's too early to tell, but it's not going to surprise me down the road that if we say, oh, for those who have had it, maybe you don't need it. But then again, do you need a booster? We don't know the answer to those questions yet.
A lot of people, you hear, well, I'm not going to take the vaccine because it's a new technique. Well, that's not true. That technique, that mRNA, has been around for a long time. I'm not going to take it because there was not enough study on it. Well, if a gazillion people in the world who have had the vaccine now isn't enough, I don't know what's enough for you. So, but to me, again, if you have any hesitancy, just contact your physician and talk it out with them. And they're not, I don't want to shame anybody. I'm not trying to vaccine shame somebody, just as I would encourage people not to mask shame those who choose to wear a mask when they go into places. But what we're trying to do is get a handle on this. Anecdotally, and not even anecdotally, a lot of the research and data that I'm seeing now indicate that the vaccine, those people who get the vaccine, just as you talked about someone who had COVID, the antibodies are still there. At first, I think people thought, well, they'll last 6 months and you might or may need a booster. Well, we don't really have enough info yet. But I think what's beginning to show is, number one, that you have longer lasting protection than we thought. Now, a booster may be necessary. We'll leave that up to the research of the medical field. But the other thing that's being shown is that the Moderna and Pfizer and Johnson & Johnson are very effective against all the variants that are out there.
Correct.
Which again, a lot of the variants are more virulent in that they infect easier. So it's amazing to me, compared to February of last year, and here we are June of the following year, just how far we've come. It just is amazing.
I agree. Think about it when we were kids and something like this would come along, it would be years before we had answers.
Yeah.
And now, early on in a pandemic, we're getting answers much more frequently and often. We have a vaccine in record time. And the reason we have a vaccine in record time is because we've been working with this scientific knowledge for the last couple decades. So it's not like somebody woke up when COVID hit and said, oh, let's invent this mRNA thing. No, it's been out for a long, long time.
You know, we have come a long way. I remember in high school back in the 60s, early 60s, they just started teaching the Watson-Crick model for DNA.
Yes.
They were talking about DNA and RNA and talking about 100 years from now what would be possible. Then we come out with a CRISPR system for introducing genes into a strand of DNA. Well, we wouldn't have thought about that, 20 years ago. It's just amazing the progress that we have made in biology and in medicine regarding these kinds of things. So is there any evidence, we've all heard about long haulers, those folks who have COVID, recover, but they still suffer the effects, which again is a good reason to get a vaccine, because you don't want to have it and you're fortunate enough to recover. And now, is there any evidence that there are more than just a few side effects going? And I know we've only been around, a year and a half, but is there any evidence that those people who have had COVID all of a sudden become more susceptible to other health issues?
So if you had COVID, it has been, there have been reports that the incidence of people who've had COVID and hospitalized for COVID, so already by definition, they have pretty severe disease, may be at an increased risk for developing diabetes. And we also know that in other inflammatory conditions, some people with flu are more prone to go on to develop diabetes during their illness or shortly after their illness. And the theory is because those infections affect your pancreatic cells, that's where your insulin comes from, and you damage those cells, you decrease insulin production, therefore you're a diabetic. Okay. So we are seeing an increase. The most recent study was about 12 to 14% of people who are hospitalized, severe disease. So yes, there are some. You do have the long haulers, and the people I talk to who have that, between their fatigue, their memory issues, their fog, it's a terrible disorder. So we don't fully understand it yet. If you're vaccinated and you get COVID, the chances of getting the long haul disease is almost nil. And there's some evidence now that shows the long haulers who are vaccinated, their long haul symptoms go away.
I had not seen that. That's cool. Yeah.
So again, everything reinforces vaccination, and I'm gonna be honest with you. I get it. I get why people are anxious. It's a new phenomena. It's a new disease. It's a new infection. It's a new, what we consider to be a newer technology, untested. So a lot of anxiety with that. And to reinforce what you've said, the number one influencer to getting your vaccine is your family physician. So it's already been shown that people who talk to their family physician and are comfortable go and get their shot. So just like you said, call your family doctor.
Well, and I can remember some pandemics, outbreaks of Legionnaire's disease and some other things that were kind of unknown back in the 70s and 80s and 90s. But this is really the first terrible disease that has reached pandemic proportions during the internet Facebook era, where you can go and be a perfectly normal person, and when you get done reading all the conspiracy theories, you'd be afraid to go outside.
Oh, absolutely true. Right. And it's really to the point that anybody can say anything. It doesn't have to be validated. It doesn't have to be data specific. You can just say it.
And somebody will believe it, and they'll add to it. And I saw that it's the ring and the circles that you say it, a few people in your ring, then the people in their ring, and pretty soon it's gained a life of its own.
It's almost gospel. I've already heard it from 5 people, so it must be true.
Right. So, you talked about a little bit, children, they seem to be relatively unaffected by this, but we don't really know what the long-term effect on their little bodies would be 20 years from now. So it would be your recommendation that they should consider having their children vaccinated when it becomes available for those who are under 12 years old.
When it's available, correct.
And we know that as we talked about, those little germ factories called schools, they are going to be more susceptible of passing infection along to each other. And if you recall, back when the schools were shut down, it wasn't necessarily because the kids were getting the disease. It was because staff and the teachers, and you can't hardly have school if half your teachers are out sick, and if the food service workers and the janitors are also gone. That was the real reason for schools to be shut down. It wasn't the kids were getting it and causing the issue.
What the one concern also, in addition to what you said, is so the kids are in school and they're giving it to one another, and then prior to the vaccine, and now for those who are unvaccinated, the kids are coming home and spreading it in their house to much more vulnerable people.
Right.
So that was really, those are the 2 big concerns.
Give it to mom and dad go over to check on grandma and grandpa, and all of a sudden those who are 60 years old and older get infected, and those are the ones we are losing. I mean, 92% of the deaths occur in those who are 60 and older. And that's why it was so devastating when it got into our nursing homes as well. And then you have a captive host in the nursing home residents for the virus just to spread like wildfire. There was a statement the other day. I may or may not have seen this on the internet, but it's so weird that I probably did. So there was somebody who got a Pfizer shot down in Florida. They came home, couldn't find Pfizer, but they could find the Moderna, and they said, it's okay, you can mix and match. Can you mix and match vaccines?
Actually, that's true.
Okay.
So they've actually looked at it, early on, because it's a 2-shot series, people have gone to some places and couldn't remember what they got the first time, so they got the other shot, and they have equal immunity. So yes, the ones we don't know about are Johnson and Johnson.
Right.
So, and just because you've gotten the full series of Moderna or Pfizer, Johnson and Johnson is not going to help you. So getting that extra boost doesn't give you added protection.
Let's talk about vaccines. I carry my vaccine card in my wallet or in my pocket. Now, Judy carries her in her wallet, so hers looks like the day that it was filled out at Owensboro Health.
Right.
And mine is so dog-eared you can barely tell what it says.
Right.
Now, as far as I know right now, no one is requiring proof of vaccination. Right. Although I've heard some countries are doing that. If you want to get into the country, you have to show your proof of vaccination. What happens if I lose my vaccine card? Is there a record? The person that issues the vaccine, do they maintain a record where I could get a copy of that?
So as soon as you get both your shots, so first shot, that information within 24 hours goes to the state.
Okay.
So that is K-High. And that they keep a record of all of our immunizations. And once you complete the series, that's there again. So yes, definitely have that. And here at the hospital, we also keep a record so that when someone calls and says, I've been vaccinated, I don't have my card, or I need to do this, we can verify that, and the state verifies that.
Does that show on my chart? Will that show on my chart?
That is a great question, and I don't know the answer to
I
that.
just
Stump me, Judge.
I just found my chart last year,
Right.
and it's the best thing I've ever found.
Oh, yeah.
I mean, it is absolutely, you know, I'll go get a blood test, and that afternoon it starts pinging, and
Yes.
it's telling me what the results of the
No,
blood
yeah,
test
that's
is.
right.
Yeah,
You know-
and reminds me of a point. It's the greatest thing. It just, you have to be a little tech savvy to figure it out. But
You do, but there's also ways, and it's not that hard. So we see you here, we send you, let's make up an institution. We send you to Vanderbilt, which is also Epic, and you can go through your My Chart and not only look at your records here, but your records there.
Oh, okay.
So
I would suspect there's some way that you can do that. I think, is there a section where you can enter or edit some information on my chart? That's what I was thinking. You may be able to just put it in vaccinated January 6th, February 4th with the booster of Moderna. And
right.
now you go. But I didn't mean to catch you in the blind there, but it just popped into my brain. So tell me, once I'm vaccinated, and this is a question I've seen somewhere, I can't remember where, but once I'm vaccinated, can I give blood? And if I give blood, does that reduce the antibodies that I have, and do I need to go and get a booster?
So that's a great question for the blood bank. My understanding is, yes, you can, if you've gotten the vaccine. And no, it does not reduce your concentration because your body is making the antibody. So anything that you lose by donating, your body replaces.
Okay. You know, I think we already talked about mingling around in social settings where we don't know whether the people have been vaccinated or not. I know there's a group of friends that we used to go out and eat together. It was tough to get a table where we could all do that, but we got together at individual houses after the restrictions on groups went away, and we knew everybody was vaccinated, so we didn't have a problem. But I think what you have said and what I kind of know is the truth. If you don't know, be careful.
Correct. So a lot of times you just need to know the environment you're going into. So even at the hospital, we do have some team members for whatever reason, and we're like you, we're not vaccine shaming, we're not, but if I went into a meeting with 5 other people and we all know that we've been vaccinated and it's a large room, people are fairly comfortable with taking off their mask. But if I don't know, I leave my mask on. So you just have to be aware of your environment.
You know, as I've followed, and one of the places on under vaccines on the state website, you can actually go in and find any county and look at it, and it will give you the percentage of people who have been vaccinated. It'll tell you 18 and over. It'll tell you percentage of total county population, percentage of plus 65. So for people who are having a hard time falling asleep at night, I would recommend that you maybe go on there and see what's happening. You know, and only people like you and I would spend time looking at that.
Absolutely true. Other than that, instead of taking a sleeping pill, go look that up. You'll be out.
There you go. But it will actually give you an idea what's going on in the communities and counties surrounding you. And by looking at that, sometimes it will give you an idea as to why counties are continually popping up and down in the orange and are in the red and are having a hard time getting out and getting down, because fewer of those folks
Yes.
are vaccinated, meaning there's more virus. And not only more virus, there's more potential for the virus to take hold, to find a host.
Right.
So,
Right.
one last thing, I guess, before we go, and I always enjoy our conversations, and perhaps post pandemic, end of this year or first next year, I'll call you back and we'll talk about. Do you remember when?
Yeah, absolutely.
Remember when
We
at
can
the beginning?
reminisce.
Yeah, at the beginning of this, back in March and April, when we would report 2 cases in Daviess County, we'd all just, oh, what are we going to do? Wring our hands. Then we got to reporting 120, 130 a day,
Right.
and it was, well, we'll get it down somehow.
Yep.
And really, I could sense a change in folks when the vaccine was released, when we started vaccinating people. I could really tell a sense in the attitude of our community, of the county, of the city, when that happened. And again, I'm just thank the good Lord for placing me in one of the greatest countries in the world,
Absolutely.
where we had the resources to do those kinds of things. Last question. Judy and I have not traveled to Las Vegas in 18 months.
Okay.
Should we be afraid to make that trip now?
I don't think so. I've started traveling myself. And again, be aware of your environment. When you're at the airport, when you're on an airplane, keep your mask on, because you just don't know. If I'm out in Vegas and I'm, on a very crowded casino floor, I'll probably keep my mask on. So I think it goes back to just be aware and know your environment. There is a real benefit to still wearing a mask, and it's not just that the mask is a barrier, but the mask is a reminder to be careful. You kind of know what's going on around you, and you have to, assume some risk. We all have to assume some risk. But no, I would actually be comfortable doing it.
Okay. Well, again, my friend, thank you for being with me.
Anytime.
As I said, I've always enjoyed our conversations. You've always brought good information
Good.
to the table. Not that I don't want to see you again, but I hope I don't have to see you again.
Absolutely. Only just to reminisce, because even at that time, I'll come on and I'll say, Friday, March 13th. That's a day that will always stick in my brain. That was our first admission.
That's correct.
Right.
Okay.
So,
all righty. Thank you, Dr. DuFrayne. Thanks,
Judge,
folks,
anytime.
for joining us.
Yep.
Going into the future, as I said, I will not have a regular COVID update, but I think what we're going to start doing is bringing back something that we called Speak Up. And it was where the county judge and occasionally the commissioners would come on TV, and we would take calls from anybody and everybody out in our community about any subject. You're quite welcome. It's just going to be a discussion. So toward the end of this month, we'll have a date, and you're welcome to come on and ask me anything that you have on your little bee-picking brain. And if I can't answer it, I'll do my best to get you an answer. So until then, everybody be safe. Again, thank you, Dr. DuFrayne. Thank you, Owensboro Health, for what you've done for the community.
Good. Thank you, Judge.